My name is Dr. Lindsay Baru. I've been practicing for 14 years. I started out with ophthalmology physicians and surgeons, and now it is part of ReFocus company. I went to Penn State main campus for my undergrad and then went to Pennsylvania College of Optometry. I am actually a second generation optometrist. My dad had his own private practice and I grew up in his office and was exposed to the field at such an early age and helped out. And the older I got, the more I realized, hey, I love this and I would like to do this for a living. My area of focus is actual medical optometry. I like to concentrate more on glaucoma, but I also see dry eye, macular degeneration, diabetic examinations, and I also do refractions and specialty contact lenses as well. I'm out of our North Wales office location, which is outside of Philadelphia. I've been here 14 years actually. I love working at an ophthalmology practice because I get to see a lot more complicated, complex patients. I also love to bounce ideas off of my fellow colleagues and use experience and their wisdom to help me improve on my own.
I got my optometric certification at the New England College of Optometry in Boston, and then I continued doing my residency for 1 year at Bascom Palmer Eye Institute down in Florida, after which I went to complete my fellowship at the American Academy of Optometry, as well as got an additional board certification with the American Board of Optometry. So I like ReFocus, and I chose ReFocus because there is a large family of subspecialties under one umbrella. Within the tip of my fingers, I have access to multiple subspecialty doctors such as oculoplastics, cornea, so I feel really that I'm part of one team instead of being a sole eye doctor, which really allows for the continuity of care. So if I need to refer a patient to another provider, I can definitely talk to them directly, get their opinion, have the patient see them, and then have the patient see me back so we can provide the best all-rounded care possible, which is something you don't get in a lot of other practices where there's only maybe one doctor with one subspecialty.
I'm an optometrist because I knew I wanted to go into healthcare, and I was debating between a couple of different fields. I loved my own personal eye doctor growing up, and right before applying to school, I actually had a visit with her, and she found a retinal hole in my eye. And I didn't even know that was possible at the time. And I had it treated, I had it lasered. Everything went so smoothly thanks to her finding this retinal hole. Niche ophthalmology is a very unique practice in that we have so many specialists under one roof. We have a retina specialist, oculoplastics, cornea, cataracts, glaucoma, contact lenses, general eye care providers. It's one of those really unique places that should be a one-stop shop for you and your family as well.
The staff at both locations here all have a tremendous amount of experience. Everyone here has probably worked in this industry for 10, 15, 20, 25 years. So the amount of things that they have seen and the amount of learning that they've done in that amount of time is such a tremendous help to me when I see patients, especially complex patients, that it makes everything so much easier, and it sort of makes patient care better from when the patient enters to when they leave. So their entire experience has a sort of a high quality sense to it in a way. So just having people around me that each know their jobs so well and take it so seriously and sort of value their ability to do their jobs well. There's a symbiosis there where we kind of feed off each other, and it ends up working great in the end for the patient. It's more efficient. The patient gets what they need in a better way. And ultimately, everyone's happier. Especially in ophthalmology practice, you don't realize how lucky you are to have access to such great technology. In that regard, it's much easier to diagnose patients and treat them when you actually are able to look deeper into the eye, when you're actually able to see things that you wouldn't see with a naked eye. It's very convenient for both the doctors and the patients here to be able to have access to better technology.
ReFocus in Manchester is a great office because we have a lot of different doctors here with different specialties, and the staff here is fantastic. Everyone here is so friendly. It feels like you're walking into a home versus an office.
One of the great things about working at ReFocus is definitely the colleagues that I work with. Everyone's part of a team here. We all work together, and that's one of the great things that I love about being at ReFocus.
As a team, the entire office, we collaborated behind the scenes for 2 months to plan what we said was a holiday party, but instead it was a surprise 70th birthday party for one of our doctors. We collected money from everybody and gifts from people. We rented a venue, had food catered, got him some amazing gifts just to celebrate him, because he's always that doctor that celebrates us and wants to encourage us to always be the best that we can be. So we wanted to reciprocate that and do that for him. And the entire office was involved. I don't think there was one person who did not help out with that.
As Chief Innovation Officer for ReFocus Eye, I'm thrilled that we have a great cadre of practices up and down the East Coast that are already doing some of the things that we all aspire. How do we get every practice to get better, right? There's no mandate. What may work in my practice may not work in a practice in southern New Jersey or in upper Connecticut or in Rhode Island or Massachusetts or Virginia. Same vice versa. So how do we have everyone look in the mirror as a practice? You know what? How do I get better, for example, in interventional glaucoma? How do I get away from eye drops where compliance is an issue and ocular surface is an issue? And how do I get better in taking care of those patients? Or in the ocular surface, how do I get better and maybe performing or offering IPL or LipiFlow or punctal or lacrimal occlusion or amniotic grafts to help restore the ocular surface? It's an ecosystem that each practice creates, knowing that there is a top-down feeling on innovating and getting better at outcomes for our patients. The adoption has to occur organically from the practices. What we want to do aspirationally to help other practices grow, you have the ability to be stronger together as a group. And we truly, truly believe that. We've had an MD OD practice now for many years. And for us, my wife and I, Dr. Swati Parekh, we've always had a flat run organization where we work together with our management team, with our surgical coordinators, with our front desk, our scribes, our optometrists, our technicians, ourselves as physicians, and our doctors that come in and join us a couple times a month. We've always worked together to really affording our patients the best in outcomes. There's nothing class-like here. It's flat, and we are all eye care professionals. In fact, this morning, we had a 1-hour meeting over a great breakfast to talk about the fourth quarter of this year and how important it is for us to really continue in achieving the best of outcomes for a large number of patients, but one by one. And everyone is an eye care professional, whether you're a surgeon, an ophthalmologist, a corneal specialist, a glaucoma surgeon, an optometrist, front desk, scribe, technician, don't make a difference. We are all the same on the team, and that team is really here to take care of our patients the best we know how. And having such a great consortium of physicians, ophthalmology and optometry is very, very woven, and it's sort of a tight community, but we feel an extra tightness, a family.